Hello, I'm Carlos Alberto. I'm thinking, what if there was a new way of looking, able to see patterns in chaos, where we only see shadows? What if the answer was right in front of us, like a last-minute game-winning goal? This new way of looking could change everything, especially in the fight against cancer. Welcome to the series AI versus Cancer, the future of health, a true fight against the disease. This series is about hope and time to react, heal, and live. It's like having a theme song for life, you know? In this fragile moment, a new tool appears, artificial intelligence, a silent ally that empowers our doctors and gives us opportunities we never imagined before, like a true friend in need. I invite you to join us on this journey of discovery. Technology can be the light in the darkness, like a lighthouse in Guanabara Bay. Let's begin. When we hear artificial intelligence, we think of robots and science fiction. But in medicine, it's much more real and close. AI is a system trained to recognize patterns in millions of images, mammograms, MRIs, CT scans. It learns from data, not emotions. It identifies tiny textures and shapes that reveal anomalies. A radiologist sees thousands of images in their career. An AI, millions in days. Its experience is global, tireless, and without distractions. It doesn't seek to replace the doctor, but rather to empower them. It's an instant second opinion, informed by millions of cases. The doctor remains at the center. They interpret the findings, talk to the patient, and understand their history. AI is a tool. Sometimes it's like an advanced microscope. It alerts the specialist. Look here, I saw something important. The final decision is always human. In cancer detection, AI is a support system, a safety net. It filters the immense medical information and highlights what's important. It optimizes the specialist's time and reduces human error. An error here can be devastating. AI doesn't feel, but its logical analysis can be a profound act of care. It helps us see the invisible and act sooner. So technology becomes a vital ally. It's not science fiction, it's today's medicine, and it's changing lives. AI makes medical excellence accessible to everyone and brings us closer to a safer future. Traditional ways of finding out what's wrong have saved lives, but they have human limits. Two doctors looking at X-rays might see different things in the same picture. AI brings in facts, it counts, it measures, and it checks against millions of examples. It makes things more accurate, and it cuts down on wrong answers, both good and bad. In hospitals that are too busy, AI can look at hundreds of pictures in just a few minutes, putting the most important cases first. It gives doctors more time to focus on hard problems and their patients. It always works the same way, no matter the time or if it's tired. It makes sure everyone can get good quality checks. It makes sure everyone gets the same careful look. It's a big step forward in fairness and getting things right, and a strong base for what's next in healthcare. Imagine teaching a child to recognize a cat by showing them thousands of photos. AI learns the same way, but with millions of medical images. It uses deep learning and artificial neural networks. It's fed by huge databases labeled by experts. At first it makes mistakes, but it corrects itself millions of times. It learns to see patterns invisible to the human eye, textures, borders, microcalcifications. It doesn't understand what a tumor is, only data and patterns. Its accuracy is amazing. Once trained, it's tested with new images. The best systems match or beat human radiologists. It doesn't give a final diagnosis, but a heat map and a confidence percentage. It's a guide for the expert eye. So AI becomes an essential support in diagnosis and a tool that saves lives. This is already happening in famous hospitals like the Institut Curie in Paris. There, AI predicts how a patient will react to chemotherapy, allowing for personalized and more effective treatments. A real-life example, AI found a resistant area in a tumor. The treatment was changed and the patient went into remission. It's not the machine curing, it's the machine guiding the doctor. At Harvard, the chief project uses AI to look at images and full medical histories. It figures out the risk of getting cancer before any symptoms show up. It's a game changer, catching the illness early, not just reacting to it. AI acts like a lookout who sees the storm before anyone else. It allows for personalized follow-ups and preventive tests. This way, medicine becomes proactive and preventive. AI connects scattered information and predicts risks that humans can't see. It's a quiet revolution in healthcare, and it's already changing lives. This is just the beginning. AI in cancer is the door to health reimagined, continuous, personalized, and preventive. Smart systems keep an eye on health data, looking for even the smallest signs. They look at images, language, genes, and medical history. They create a digital copy of our health. This brings up some tough questions, like privacy. Who owns the data? And what about predictions without a cure? The challenge is to find a balance between new ideas and what's right. The possibilities are huge. Exact treatments, finding things early, and less pain. This isn't just a dream, it's a path we've already started. Every step forward brings us closer to a future where cancer is found before the fight even begins. Behind the technology, there are people and lives changed. A skeptical radiologist trusted AI and found early-stage cancer that she would have missed. Patients get diagnosis thanks to AI's double-check. A man had surgery in time because AI found a lump invisible to the human eye. AI lowers worry. Early results in minutes, less waiting and pain. Suspected cases are put first, making care faster. Researchers and young engineers see their work as a mission. Every line of code can save lives. It's a new group of cancer fighters from the digital world. Their battlefield is data. The win, earlier diagnoses and better treatments. Hope grows with every success story. AI doesn't replace, it helps and makes things better. And every life saved is an echo of hope. So this change is very human. Today we've traveled through a place where human and artificial intelligence team up against cancer. AI doesn't replace a doctor's caring touch, it makes it even better. Examples from Paris and Harvard show that the future is already here. Medicine that can predict, that's made just for you, and is more human. By freeing doctors from doing the same things over and over, we give them more time for what really matters, being there for you and taking care of you. Every minute we gain is a win for life. This is the first part of artificial intelligence versus cancer. In the next episode, we'll look at how AI helps create new treatments. But first, I want to ask you, do you agree to keep making preventive medicine better with artificial intelligence? What would you focus on as a tool in the fight against cancer? Subscribe to the channel and share your thoughts in the comments. See you in the next video of the series. Until next time, friends.